Hello, I'm Sulin and welcome to HBW-TV. Today, we are at H Clinic and I'm joined by Dr. Ng, a practicing doctor of 12 years with special interest in preventative medicine for 8 years. She's extremely passionate about this topic and today will be sharing with us her professional opinion and experience on this matter. Thank you for joining us today.
Hi, thanks.
So let's start off with why preventative medicine? What is the emphasis?
I would like to highlight preventive medicine is very important these days for obvious reasons. Of course, the most important one is because we are prolonging lifespan, but we don't want to live all the way up to 80 or to 100 when our quality of health is not good. So preventive medicine can actually prolong your lifespan and so improve the health quality. On top of that, definitely, it's more cost effective. We wouldn't want, comparatively, if you are spending on health screenings, it's definitely much more cheaper as compared to your hospital stays, your surgeries. And on top of that, preventive medicine also is avoiding us to have unnecessary risk of procedures, surgeries, and also stress. Stress to the mental, the emotional, to the patient, and also the family members, the caretakers. So I think preventive medicine is the way to go.
Yeah, that's very true. So we had a little bit of personalized healthcare in our conversation just now. Could you tell me more about why personalized healthcare?
I've been doing preventive medicine for 8 years now. Okay, midway I noticed something, I hit a roadblock. Although my patients see me regularly on every year basis, but that does not mean that their health actually improved on yearly basis. So I noticed that maybe my approach is wrong. I attempted another new approach. It's called personalized healthcare, where it's more personal. It's individualized to my patient's need. We spend a lot of time on discussion. I ask a lot of questions about their family history, their routines, their habits, their risk, their concern, and then we will sit down and discuss what kind of set of tests they should do, and then when the results come back, we discuss again what's the possibility of the risk factors, how they can improve, and then we follow up. I think this personal approach, both myself and my patient, we prefer it because we can see that the outcome is better. There's got more personal touch, and also it's patient felt that their concern is being taken care of.
That's very true. So you talked a bit about benefits. You mentioned that that's the case. Could you highlight a bit of the benefits of personalized healthcare for us?
Most obvious ones is I'm addressing my patients' risk and concern straight to the point, instead of making my patients do health checks year after year, but actually end of the day their concern and risks are not being addressed. Okay, by doing personalized healthcare as well, I actually make my patients get very involved in their own health journey, because I would like to I always share with my patient that it's very important for them to take responsibility of regards to their own health. It's not my responsibility. My role is just as an educator. I guide them. I try to help to find out what is their issues. I share with them all the information, but they must be aware that the outcome of their health journey very much depends on their involvement, how much effort, how positive the attitude is. So by doing personalized health screening, we can achieve that.
You talked about something that sounds like a factor. Could you mention a couple of other factors that contribute to successful personalized healthcare?
Patient involvement.
Yeah.
Number one, patient needs to be they need to have the willingness to change. Okay, they can do health screening every year, and they get the information. I can see them after a year, and if they got no change, the attitude did not change, they don't put any effort, they're not going to see improvement in their health. So patient involvement is very important. A good relationship between the doctors and the patient, a good rapport. Because when you have good relationship, patients tend to tell you a lot. When you ask questions, they trust in you, so they'll be very honest with their effort. So a good relationship, I think, is a very important factor as well. And also follow-ups. You wouldn't want to know the condition and then you didn't put any effort, or you put effort, and then you want to know whether you're improving or worsening, or whether your effort is in the right direction. And I would encourage that the follow-ups to be done best by the same doctor, because then you can see your progress. If you are seeing different doctors at different centers, you cannot compare if you're doing better or doing worse. Then you don't know what to work on. Yeah, so these are the factors that I would say contribute to a successful outcome of personal healthcare.
Yeah. And some people, after they recover, they stop going for their follow-up treatments and stuff like that as well, because they're like, oh, I'm okay.
I even when they're okay, I usually put a 3 or 4 months follow-up with my patient. I'll tell them, come back, just talk to me. If you're doing better, let me know. If you're not doing better, come back, and if we have a 4 months gap, you come back, you've got new problem, we can discuss again. Because I can initiate, I can suggest a plan. That does not mean it will definitely work 100%, because a lot of times it's patient's effort. It's a patient factor, right?
Definitely.
So we always recheck after 4 months, we follow up. So patient felt better, they feel that they are being taken care, and they're not alone in this journey. Yeah, I need to reassure them that I'm here to guide, I'm here to solve any problems that you have, but a lot of the contributing factor to a successful health journey has to come from the patient's attitude, patient's effort, that they need to realize and need to agree upon.
Very true, very true. So in your opinion then, what areas of healthcare require more attention or awareness?
Through my experience, if given the opportunity, I like to highlight about gut health.
Gut health.
Gut health. Indigestion. You know, 8 out of my 10 patients have bloatedness. They have, they feel that their stool is a bit soft. They have heartburns, and it is very common for patients to have this problem to the extent that they thought it's normal. But it's actually not. Those are just signs that they actually have very unhealthy gut. They don't know the importance of taking care of the gut, because the thing I want to highlight is that it's related to immune system. It's related to your mood. Yeah? It's related to the inflammation in your body. So a lot of things are linked towards gut health. So it's one issue that if I have the opportunity, I will bring it up. Why you have gallstones, why you have fatty liver, all this. Why are you malnutrition? You cannot absorb well, your nutrition is not great. Yeah, all these are related to gut health. Many issues. I like to talk about male health. I like to talk about testosterone. Okay. We tend to focus a lot on menopause, female, because it's very obvious when they don't get their menses, their menopause. So everybody knows about menopause. Nobody pays attention to male's health. So testosterone is very important. Not only I want them to talk about testosterone when they're in their 60s. I hope that the young males in their 30s and 40s are taking care of themselves. They know the importance of the male testosterone. I like to talk about bone health. Bone health. You know, when you have relatives in their 70s and 80s, following a fall, they get a fracture. They're going to spend a lot of their time on the bed. That's poor quality of health. But to be afraid of that kind of scenario, you need to do preventions, and preventions don't happen from after the age of 50. It actually happens when you're in your 20s, your 30s. So these are preventive medicine where you practice a good lifestyle. You do all the preventions, decades even before the disease sets in. So these are the awareness I like to talk about. Sleeping early, good lifestyles.
Those are definitely very important issues, and something that we could all incorporate just by a simple change in lifestyle. Just
definitely.
Here and there.
It's just small changes, but it goes a long way. Practical changes. We're not taking away all the happiness, all the things that you enjoy, but if you practice little changes at very young age, you benefit at your later life, in your 50s, in your 60s.
Because it's important to be consistent and have realistic goals, instead of saying that I'm going to do something, but then you end up not doing it because you only did it for a week because it's just not right for your life.
I like to tell my patients, you don't tell people that I want to stay young, I want to look young, I want to feel young, and by just saying it's not going to happen. You actually have to do something about it. Then only you get to stay young and look young and feel young, you know. So health doesn't fall from the sky. Okay, and my famous quote, it doesn't fall from the sky. You have to work for it.
Definitely. So we talked about being healthy. How would you define being healthy?
My definition of healthy is huge. I emphasize to my patient that sleep is important, mood is important, happiness is important. So for example, they can come to me with their blood test report, probably tip-top, everything is good, no diabetes, no cholesterol, but that does not equals to healthy. I like to ask my patient, do you feel healthy? On their first visit. And when I follow up my patient, I would like to ask them again, do you feel healthier? Okay, so to me, health it's a very big, it's a big topic. It's not just confined to tests or procedures that you do. It also involves many things: happiness, sleep, lifestyle, all this.
Because it's not just your physical being in that equation, it's also your mental health and how you feel about everything in general. All right, I think that's all the time we have for this session. Thank you very much for your time. We hope to see you again soon.
Thank you for having me.
Thank you.